Now, it's very important to look at what we will be doing. Under our summary, we will be looking at our introduction, as well as the general codes of conduct in ethics, then the role of the healthcare practitioner, principles applied to wound care, and then recommendations, conclusions, and then the references that I've used for this presentation. Now, under introduction, it's important to note that a patient with a wound needs a diagnosis. And in order to make this diagnosis, you have to collect information. And this information will lead you then to your option plan of management for the wound. Now, when you decide on an option of wound management, you have to weigh the benefits as well as the risks. Now, once you have done this, you will then have an informed treatment plan. Now, it's important to reflect whether or not this treatment plan you are deciding on, has it been guided by ethical principles? Is it necessarily the best plan for the patient? Is it based on evidence? And those are the considerations that you have to make. Now, medical ethics, what is it teaching us, or what is it guiding us? Medical ethics aim to provide a structured approach to the best possible answers to common ethical dilemmas, while in philosophy, ethical behavior is stated as that which is good or right, and many a times it's difficult to decide what is right for a given situation or for a given patient, because we are all familiar with ethical dilemmas. Modern society, however, teaches us or considers the principles of treating others with dignity, honesty, fairness, respecting diversity, as well as the right of individuals. Now, patients are vulnerable due to illness or their wounds. Healthcare professionals, on the other hand, are the one with the education and the knowledge. And because of this education and knowledge, they have a relative position of power in relation to the patient, because they are the ones who will be deciding on their treatment plan. Now, the code of ethics are needed to enable healthcare practitioners to apply a professional relationship in line with the patients as well as their colleagues. And that is where ethics comes in. Now, as individuals, we all have personal values. And it's these personal values that guides us. Whether you value honesty, integrity, but you do have your own personal values. And it's these values that serve as standards or criteria to guide the selection or the evaluation of your actions, how you apply policies, how you treat people, your clients, your patients, or events. Now, as people, we decide what is good or bad, what is justified, what is illegitimate, what should we be doing or what should we be avoiding. Now, based on these possible consequences, we usually evaluate our cherished values. Now, the impact of our values in everyday decision-making is really a conscious one, because you don't really think, who am I going to greet today? As you were raised, they usually say charity begins at home and values also begins at home. But our values only enter our awareness. In everyday decision, our values only enter our awareness when there is actions or judgments that one has to consider. And when these actions or judgments are conflicting or having conflicting implication for different values that we cherish. And therefore, it's important that you must be aware of what is the personal values that you yourself as a human being or as a healthcare practitioner cherish. Now, we have certain codes of ethics that governs us when we treat our patients or our clients with wounds. Now, one must observe the ethical codes under the following statutory bodies. Now, we have the Health Professions Council of South Africa, we have the South African Nursing Council, and then we have the South African Medical Device Regulatory Authority, And then we also have the Department of Health. And these are our statutory bodies that has ethical codes. And it's these ethical codes that I will be discussing now. Under the Health Professional Council, they have the following ethical principles that I've listed here. And the first one is respect for patients, their dignity, human rights, compassion, tolerance for cultural differences or religious beliefs. And it continues with the following principles. Non-maleficence, which means or which relate to the concept of first do no harm. Then we also have beneficence, when you act in the best interest of your patient. I think I'm not talking to my slide. If I can just have the next slide. Yes, as I said, non-maleficence, which relate to first do no harm. Preventing harm is more important philosophically, morally, and legally than doing good. Beneficence talks to when, as a healthcare practitioner, you have to act in the best interest of your patient. You might decide what is best for your patient, but when you do this, make sure you have informed your patient what is the best practice for this wound that the patient is having. Consider the patient's fear, their ignorance, their vulnerability. Because remember, because of the wound or the diagnosis, the patient is vulnerable. Then we have autonomy. And this is one which I think we sometimes really take for granted. And autonomy speaks to the patient's right to make his own decisions after being provided with the necessary information. And autonomy also relates to informed consent, because we sometimes confuse informing our client about the skill of the procedure that we have asked the patient's consent. Consent simply means, do you agree with what I am tasked to do? And that's the one that we many a times violate as well. We don't greet our patients. We don't inform them on the procedure that we are going to do. We don't inform them on the length, or we do not inform them on the intervals of wound care or on the medication that they should be getting. Now, when we go to the South African Nursing Council, they also have an ethical code which governs the nursing profession. And in fact, ethics is the foundation of the nursing profession. Assurance, and it also gives the assurance to the employer as well as the public that nurses will operate within the recognized moral standards of care. It also gives the assurance that health will be promoted and restored, and that nurses will be advocates for their patients. They will talk on behalf of their patients when the patients cannot speak for themselves. Then it also gives the insurer assurance that illness will be prevented, life will be preserved, and that suffering will be alleviated. Now, these responsibilities will be carried out with the required respect for human rights, which includes, again, the cultural rights, the right to life and dignity. Now, when we look at the ethical principles that is listed in the document for the South African Nursing Council, it speaks to justice, social justice, as well as non-maleficence, which is also under the Health Professional Council of South Africa. The next slide, please. It also speaks to beneficence, which we have discussed, and then veracity. Veracity simply means truthfulness and honesty, which again, as I've said, relate to your personal values that you have. And then fidelity, adherence to factual and truthful accounting and balancing of information. At the same time, respecting, protecting, and maintaining confidential information. Then we have altruism, which is the concern for welfare and well-being of others. And again, here we have autonomy. Now you can see when you look at the common principles that we are having between the Health Professions Council as well as the Nursing Council. Now here I'm just depicting the professional misconduct cases that was reported in 2019 at the South African Nursing Council. You will see there under maternity-related misconduct cases, we have 11, poor nursing care, medication-related misconduct cases, fraud or forgery, assault of patients or colleagues, acting beyond the scope of practice, because all nursing categories has a scope of practice. For example, you cannot ask an auxiliary nurse to do an irrigation wound. They are supposed to do a basic simple dressing. Then you also have poor control of scheduled drugs, denying patients access to healthcare, invading a patient's privacy, or falsifications of patients' records. Now, when you look at the number of cases, you might say, but there are 30 cases for 5 provinces. But now you must remember, these are 30 families that has been affected. And these cases are clearly violations of ethical principles. And now it is also important to remember that these are the cases that has been reported to the Nursing Council. How many has not been reported? How many has been handled at the facility level? And then the question is, were they really resolved? Did the patient get satisfaction after the resolvement of the cases? So it might seem as little, but in fact, it's quite a lot of misconduct cases that relates to ethical principles. Now we will discuss the next one, Department of Health. And I've put the public sector, but remember, Department of Health ethical codes also is applicable to the private sector. Now, I only took out 3 documents under Department of Health. The first one is the Batupele Principles. Now, here is only 3 that I'm speaking to because I'm relating it to the previous ones. The first one is access to care. All patients has the right to access, has the right to health care. Patients has the right to be treated with courtesy, and patients must get value for money. Then we have the Patient's Bill of Rights, which again talks to access to information, equality and fairness, right to treatment. Now, I'm not going to talk a lot about access to information because we did a presentation about 3 or 4 weeks ago on the POPI Act, but this is just to show you when we talk about ethical principles, how does it relate to our wound care? The patient has the right to your records, which should be truthful and honest about his wound care that has been done and how the wound has progressed. When you look at the National Health Act, I specifically took out this one that talks to the discharge report. Now, the discharge report states, the National Health Act states that every patient has the right to a discharge report when the patient has been treated, and this report should contain information on the nature of the health services that was rendered, on the prognosis of the patient, as well as the need for follow-up. Now, this is important because many a times we would refer a patient from a tertiary hospital to a primary healthcare clinic. And in this report, we should give clear guidelines on what should be happening when the patient gets there. However, sometimes it happens that what we are prescribing at the tertiary institution is not necessarily available at the primary healthcare level. And that is also a violation of the patient's right to treatment. Next slide. This is now just to show you between the 3 statutory bodies, the HPCSA, the South African Nursing Council, and the Department of Health. What is the ethical threat that we have when it comes to ethical principles? All 3 of them talks about autonomy, acknowledge the patient's right to make his own decisions, beneficence, one ought to prevent and remove evil or harm, As I've said previously, as nurses, we must remember we have tasks that we should do. We have to perform administration of medication, routine wound care. However, when it comes to autonomy, the patient has the right to refuse. And that is what we should not forget, because now it's beneficence versus autonomy. We also have the South African Medical Device Association, which also have an ethical code. They also have ethical principles. And the purpose of these principles is to regulate companies in terms of marketing and how they run their business. What I've listed with them is the principle of transparency. Now it states under transparency, interactions between industry and healthcare practitioners must comply with national and local laws, regulatory laws, and professional codes of conduct. Then we also have equivalence. Healthcare practitioners engaged by a member of industry to perform a service on behalf of the member must clearly state what remuneration will be paid by the member, and it must be of a fair market value for the services performed. Now, this is an important one when you look at everything that's been happening in terms of PPE in our country. Then another ethical principle in their document is documentation. For interactions between industry, companies, and healthcare professionals where services are rendered or performed, these interactions must be a written agreement that states what services will be rendered, the method of reimbursement of expenses, as well as the remuneration that will be paid. And just to make an example, when we say it must be fair to the market value, you cannot be asking a healthcare practitioner as the industry to do a presentation on wound care, and then you pay for the flights, the accommodation, you pay him remuneration of 40,000, and then you do renovations to his house for 60,000. You see, there is where ethical principles are being violated. And as you know, we have many of these examples that's going around in our healthcare system. Now, the next one that we will be talking on, regulations, is when it comes to companies. Obviously, we know that in terms of medical technology, there has been a lot of growth over the years. We have advanced devices, but when it comes to the devices, one needs to look at the benefits versus the adverse events, as well as the price of technology and dressings. And we know when it comes to wound care dressings, there are so many products to choose from. However, these products are not necessarily available for everyone. Therefore, one needs to look at what is the indication to use and when to use. Who is going to pay for it? Also, at reimbursement from medical aids. Will the medical aids pay for the type of dressing that you have chosen? And also, not forgetting, when it comes to autonomy, beneficence, the patient's expectations. What is the available technology? Is there pressure to create income, especially survival for the private sector? And then one also needs to look at litigations when you have under-treatment versus overuse. So these are important points to consider when it comes to your application in wound care. Now, the role of the healthcare provider. When we look at ethical behavior within the organization, we also have the complaint, substandard treatment that is being offered. You will always see it on the news, in articles, on the digital platforms, and it has become probably a norm by now that we have shortage of staff to deliver care. But is this ethical? Is it ethical that a patient has to wait for his medication, for his dressing routine? Is it ethical when there's lack of monitoring? Is it ethical when we don't have appropriate audit reports that speaks on the type of care that we render, the type of dressings that we are doing, reporting of concerns? Because one of the big challenges that we find with auditing is, for example, recording of the wound care done. Many a times you will find one sentence written there, wound care done, no information on what was the wound, what cleaning solution was that was used, what was the dressing done. Sometimes you even find that the time or who did the dressing, you can't even make that out in the report that was done. And these are challenges that we have with auditing and then reporting. And then also lack of monitoring when it comes to complaints from the patients. Then we have the tender process for devices and dressings. And here we also saw what's happening on the news currently, because when it comes to tender processes, many times it's being flaunted with all other reasons that's usually given for that. Then we also have the buyout system that also poses a threat, because when something is not on the tender process, it needs to follow the buyout route, which also open opportunities for unethical behavior. Now, it is also important to note that you also need appropriate knowledge and training in order to do your wound dressings. If you do not have the appropriate knowledge and skill, what are you doing to the wound? If you cannot identify the type of wound that you have. Now, adequate competencies and skills to treat patients must be acquired through wound care courses. Then again, the question comes up, these courses that are offered, are they offered by accredited institutions? Then we have the big problem in nursing education currently. When you look at centralized education units, I can say safely, especially in our provinces, when you look at state-owned entities, facilities, it's a requirement that we should have centralized education units that ensures ongoing training. But however, due to shortage of staff and funding, they are not always there, because those are the units that ensures consistency and relevance, and that ensures that the latest practices and skills are being applied for wound care. Then a very important point that one also needs to look at is recognition of the patient's suffering, pain management. Do we ensure that the patient is having adequate pain management prior to a wound care dressing? Or do we just assume that no, the patient never complains, so therefore it is not necessary to check with the patient? It comes back to beneficence and non-maleficence, as well as the autonomy of the patient, checking with the patient, asking the patient, how is your pain level? I'm going to perform your wound care procedure at 2. Would it be fine if I give you your wound care medication at 1:30? How do you feel now? Those are important ethical principles. It applies to wound care. Then when it comes to now funding of treatment, an example that I'd like to make here is that many times when the client is in the facility, in the hospital, their treatment is being authorized. However, when the patient needs to be treated as an outpatient, for example, with negative pressure wound therapy, now it is not being funded because authorization is limited to the hospital. A very important point is also access to treatment. Many a times when the patient is in a tertiary facility, yes, there is availability of certain wound care dressings. However, when you refer the patient down to the primary facility or to a district hospital, the same wound care dressings is not available there. And that is also an infringement of the patient's access to health care. Then we also here, I've listed infrastructure. Our infrastructure is many times not ideal to give the patient also the optimal treatment. Remember, here we talk also to basic things like ensuring privacy for the patient, because that's the patient's right. consent to share information for funding. We had a presentation on the POPI Act, so I will not talk to that. It was deliberated in that one. Then also, are we using the relevant evidence that's out there? Is there enough? Do we rely on randomized clinical trials for wound care? Do we apply this in our practice? So these are just points to ponder on when it comes to ethical applications of wound care. Now, under my recommendations, I would like to state that it's very important to adhere to the principles of ethics in our daily wound care practice. And one should reflect on the influences of ethical values, behaviors, and interactions, not just between healthcare practitioners, but also between healthcare practitioners and the public, our stakeholders, as well as the healthcare users. And as healthcare practitioners or industry, we should all be held accountable for our acts and our omissions when it comes to health. And I'd like to conclude by saying that ethical principles indeed is our blueprint to ensure fair and justice and fair practice in terms of wound care treatment, not only in our interactions between us as healthcare practitioners and health users, but also between colleagues, regardless of their hierarchical level of knowledge or professional discipline within the multidisciplinary wound care team. Because you saw the misconduct cases that I've shown, some that was assault of patients and colleagues, because sometimes we can become, as a multidisciplinary team, we tend to fight and then we forget about what is the common objective, the benefit of the patient. So let's use our ethical principles as our blueprint to ensure that we treat our patients fair and just. And I'd just like to show you some of the references that I've used, the ethical documents that I've used to compile this presentation, which is very useful. You can go through them and then read them for yourself. And I would like to thank you for listening to me on my presentation. And this is the response that we usually get. When it comes to privacy regulations, we assume that it's common sense. And then we usually ask the question, who have time for that? And when it comes to experience, it's very important to leave it for those questions of ethics to the ones who have the necessary experience. I thank you for listening to me.
Thank you so much, Sister Linda.
Good evening, everybody. Yeah, I just want to say I'm not a lecturer like Sister Linda, so bear with me. I'm only a nurse working in the hospital, so I'm not used to what we're doing tonight. I want to build on what Sister Linda said. And while we now had a discussion on the role of ethics in the wound care setting, let's talk a little bit about a few ethical or perhaps unethical behaviors and practices that we have in a healthcare facility. There are different perceptions, as we heard she also said, on what is ethical behavior, and therefore ethical dilemmas can place a healthcare worker in an awkward situation. So I've asked some of my enthusiastic colleagues to help me to reenact a few scenarios that we can use as a discussion tonight. Hippocrates was a Greek physician. He was born in 460 before Christ. He was an excellent physician, and he made a permanent influence on the development of medicine, as well as the ethics of physicians. Today, we use the Hippocratic Oath to bind them to follow the ethical practices. But not only that, Florence Nightingale and the Nightingale Pledge was for the nurses was also built on this oath. So it's just a modification of this oath. So one of Hippocrates' quotes that I think that is really helpful or important for us in wound care is the one that he said, as to diseases, make a habit of two things, to help or at least to do no harm. You can go to the next one. Management of wounds may pose ethical challenges. Is it then possible to follow this rule of Hippocrates of do not do harm? And then there's questions that pop up. Do healthcare workers still have ethical standards? Do healthcare workers still take care of their patients, treat them with dignity, and act as their advocates? Do healthcare workers still have values, and are they willing to protect their patients from unethical practices? And then some other questions that we come by is, what role do medical aids play, predominantly in the private sector, dictating treatment plans? Are the most effective wound care products available to all, especially for us in the public sector? Do companies providing wound care products influence the way these products are used in the practice? Now we have a little video clip that when a clinician came to conduct her rounds. So let's see what happened there. Okay, what did we see? All the unethical principles. The clinician entered the room. She did not introduce herself. She did not identify the patient. She did not talk to the patient. She did not explain to the patient what is going on, what she prescribed. She did not even do hand hygiene. She opened the dressing, but she left it open. And last but not least, she didn't even provide any privacy for the patient. We can go to the next clip. So here's another video clip. Let's see what happened here. Okay, once again, the nurses entered the ward. They didn't introduce themselves. Actually, they were in a conversation about what happened the weekend. They were playing music, they were chatting, they were dancing, they ignored a poor patient there. If you can see, she turned her head this side and that side, not included in what is going on here. It's actually, she's supposed to be the main person there, but nobody even looked at her. No identification of the patient. They didn't even talk to the patient. They didn't explain to the patient. Once again, no hand hygiene. And as they went there doing things, I think the sterile things was also breached there, and still no privacy. Okay, now let me see. We have another scenario. So my colleagues did help me to create a new scenario, and they did do a few things right this time.
Morning. I'm Dr. Paloi, and the new doctor in the unit. I'm coming to see you today, ma'am. What's your name? Okay. Let me quickly spray. All right. Let me check you. How are you this morning, Mr. Okay, mommy. Quickly check your wound. How is the pain, ma'am? The pain is very sharp. All right. No resistance. Will you do something for pain yet? All right. Oh, I see the wound is the area there. Oh, it's not swollen. All right. Okay. I'll just open. Relax, ma'am. Okay. All right. Sorry. Okay. Oh, the wound is looking nice. It's on around. It's looking nice. It's only a little bit dirty inside now. All right. So now I'll just prescribe Hippocrates and Hippocrates to clean around the wounds. Okay. All right. The sister will come and for you for a minute. Yeah, dressing will just maybe for 2 days now. So after 2 days, we'll just check how is the wound looking, and then we'll take you for operation for the pregnant. But then the other doctor will explain everything for you. Okay. Okay. Sister will come in here. Thank you. See you later. Okay.
Okay. This time she came in, she introduced herself, she made sure that she's with the right patient. She explained nicely to the patient what she's going to prescribe and what the way forward will be. She did do hand hygiene and she covered the wound. So a little bit better, a few improvements from the first video. Okay, let's see what happened here.
Morning. Good morning. How are you this morning? Hi. My name is Sister Tonto, and I'm here to do your home today. And by the way, what's your name? Mantovitz. So it's you, Rudolph Mantovitz. Yes. Okay. I'm here to do your home panty. So hope we will get along well. Okay. Oh, I can see the sister gave you movement for pain 30 minutes earlier. How is the pain now?
The pain is better. Sister.
Is the pain much better? Okay. All right, thank you very much. I see the doctor has recommended I must do pectigrass and infrared for your dressing on your home. So we're going to do the dressing, and the dressing should be kept closed for about 2 to 3 days. So is it fine with you? Thank you very much. Let's start.
Okay. This nurse entered the room. She introduced herself. She identified the patient. She explained to the patient. She confirmed the pain medication was administered. She did do hand hygiene and she did provide privacy. So with these clips, we want to make it clear that many of the unethical principles, as discussed by Sister Linda's presentation, can be seen in both the first two video clips. The Code of Ethics for the nurses and the HPCSA guidelines both include the principles that Sister Linda explained: the respect, the compassion, to protect your patient, your accountability, beneficence, non-maleficence, autonomy. So most of this was ignored or disregarded in the first two clips. So that was just a little bit of, just to show it visually, that we do so many times, we do things without thinking. So the recommendations that after this, watching this videos, is that ethical principles must be embedded in our daily routines of healthcare professionals, inclusive in the performance of wound care. And time constraints, shortage of staff, or limitations of material must not be an excuse to omit any ethical principles. So if there's any questions, otherwise I will say thank you for your time and for listening to me.